Hello, my name is Leon Rocha, and I'm Senior Lecturer in Chinese History and Society at the University of Lincoln in the UK. In March 2021, the death rate in the United Kingdom for the coronavirus pandemic passed 120,000 people. According to Johns Hopkins University Coronavirus Research Center, the UK now has among the highest COVID-19 death rates in the world. In the media and among researchers, we've been focusing on regions which have had far greater success in containing COVID-19, particularly Asian countries such as Taiwan, Vietnam, Singapore, Republic of Korea, and Hong Kong. One of the explanations of these Asian countries' success is the high level of public trust in the government, or at least the general favorability towards the government as reflected in opinion polls. This has led to greater acceptance and compliance to public health intervention. Indeed, as the former Foreign Minister of the Republic of Korea, Kang Kyung-hwa, emphasizes in a World Health Organization interview, the most important ingredient in South Korea's battle against COVID-19 turns out to be public trust, especially as the Korean test, track, and trace system involves the infringement of citizens' privacy by using mobile phone location data, credit card transactions, and CCTV footage to identify potentially infected people. The case of Hong Kong, however, may complicate this narrative. Hong Kong has a population of 7.5 million and is one of the most densely populated cities in the world. It is also in close proximity to mainland China and is a major transport hub in Asia. So far, Hong Kong has recorded 201 COVID-19 deaths and has just had its very first lockdown that was limited to several neighborhoods in January 2021. But public trust in Hong Kong government is perhaps at its historic low. The approval ratings of Hong Kong government and its current chief executive, Carrie Lam, have been consistently negative. In May 2020, the rating was minus 80%. I would argue that Hong Kong's success in dealing with COVID-19 could be, in part, attributed to the fact that Hong Kongers are radically skeptical, if not openly hostile, towards state government. This meant that Hong Kongers, in the beginning stages of the COVID-19 pandemic, moved swiftly to safeguard themselves and their families, and they were often well ahead of government policies, and this spurred the alternately differing or obstructive Hong Kong government into serious action. While we could point towards the 2014 umbrella movement and the 2019 to 2020 anti-extradition law protests as the source of Hong Kongers' mistrust and dissatisfaction towards their government, I would suggest that, especially when it comes to matters of public health, the mistrust actually runs deeper. In May 1997, just 6 weeks before the handover of Hong Kong from Britain to the People's Republic of China, a 3-year-old boy who played in front of a shop selling live chickens died from avian influenza H5N1. Margaret Chan, who was then Director of Health, tried to reassure Hong Kongers with public statements such as, "I ate chicken last night," and "I eat chicken every day. Please don't panic." By September 1997, H5N1 evolved into the first full-blown crisis for the newly formed pro-Beijing Hong Kong government. And in the end, 6 people died of H5N1 and 1.6 million domestic fowl was destroyed in December 1997. Margaret Chan was ridiculed for her incompetence and arrogance in the handling of H5N1, and she became nicknamed Chicken Chan in the popular press. 6 years later, in 2003, Hong Kong confronted the SARS crisis, in which 299 people died. one of the biggest clusters of SARS cases formed at Amoy Gardens, a well-to-do residential area in Jordan Valley. And once again, the Director of Health, Margaret Chan, was at the center of the storm. Chan and the then Chief Executive Tong Chi-hua were criticized for their foot dragging and were accused by families at Amoy Gardens for downplaying the threat of SARS and withholding epidemiological statistics in the interest of the Chinese government. The Amoy Gardens outbreak led to the creation of Sosek.org, an internet forum for sharing information about SARS hotspots, which then successfully pressured the Hong Kong government to release daily data on infected locations. And if you click on sosek.org right now, it will now lead to a brand new website called COVID-19 in Hong Kong. Now, the combination of Hong Kong's troubled experiences with avian influenza and SARS meant that Hong Kongers understood that these dangerous illnesses affected not only the poorer citizens, they also cultivated a heightened sense of vigilance towards epidemics. For instance, the widespread acceptance of mask wearing, even during subsequent normal flu seasons. And Hong Kongers, despite the many layers of political divisions, also developed a general suspicion towards the Hong Kong government, especially in matters related to public health. And that suspicion was then extended to the World Health Organization. When Margaret Chan was appointed the 7th Director General of the WHO, an appointment that she would hold until 2017. The People's Republic of China was perceived as having tremendous financial influence over the workings of the WHO. And when WHO officials and advisors during the current pandemic repeatedly avoided discussing Taiwan's widely praised COVID-19 strategy, the impression that WHO had been captured by China deepened. To the extent that significant number of Hong Kong activists, especially those who participated in the anti-government protests, actually cheered Donald Trump when the United States withdrew from the WHO in July 2020. In January 2020, COVID-19 was first confirmed to have spread in Hong Kong, in the middle of widespread civil unrest triggered by the introduction of the so-called Fugitive Offenders Amendment Bill by the Hong Kong government, i.e. the extradition law. In October 2019, Hong Kong's current chief executive, Carrie Lam, invoked colonial-era emergency powers to ban the wearing of face masks. This would later be ruled unconstitutional by the Hong Kong Court of Appeal. Hong Kongers collectively defied Carrie Lam's anti-mask law and ignored the WHO's guidelines at that time and adopted nearly universal face mask wearing. Deep levels of grassroots organization and the spirit of mutual aid, a constant feature of the protests in 2014 and 2019-2020, were rapidly redeployed by young activists towards combating COVID-19 in local communities. And this included the delivery of free food, household essentials, and PPE to vulnerable people and the elderly, the installation of hand sanitizer dispensers in deprived neighborhoods, university students helping children and teenagers to catch up with schoolwork through online tutorials, and the use of secure messaging apps like Signal and Telegram, which were previously used for sharing intelligence on police activity and blockades during the protests, and is now redeployed to keep track of local outbreaks of COVID-19, as well as useful information such as waiting times at hospitals and clinics, or to rapidly fact-check news reports and announcements coming from the Hong Kong and Chinese governments. Importantly, the radicalism from the protest movements has also rejuvenated moribund labor movements and trade unions, with predominantly millennial and Generation Z activists taking the mobilization into the workplace. This pressurized employers to go beyond Hong Kong government guidelines on PPE supplies to employees and guidelines on working from home. The most remarkable event was the unprecedented industrial action undertaken by almost 6,000 nurses and healthcare workers in February 2020, organized by a new trade union called the Hospital Authority Employees Alliance, the HAEA. The HAEA's members demanded the Hong Kong government to implement stronger border control measures, and Hong Kong would eventually close its borders to all non-residents in March 2020. Now, I've been asked to reflect on the possible lessons from Hong Kong for those of us living in Britain. And of course, it would be simplistic to suggest that the lesson is to screw the government and save ourselves. However, the case of Hong Kong does provide perhaps a rather old lesson, one that needs to be learned and relearned. That even under extremely challenging political circumstances, so in the past weeks, the Hong Kong government has been systematically arresting activists using the national security law, citizens are perhaps not completely powerless and without influence. So the lesson perhaps is be informed, join a union, get organized locally. The government is probably not your friend, and expect no saviors and no shortcuts. Thank you very much for listening.